Guys, today we will learn how to write a diagnosis for hemiplegia. So we know that writing diagnosis is an important part while we writing a case. Okay, as an MBBS student, it's very important. As a final year student, it is very important. Okay, so first of all, we have to write it is a cerebrovascular accident. We have to write it as a cerebrovascular accident. Okay, then we have to write it as whether it is then we have to it is a neurological, then anatomical, then pathophysiology, and its etiology. These four things should be included in our diagnosis. What all things? It's neurological, anatomical, pathophysiology, etiology should be included in our diagnosis. Okay, the neurological, what do you write is whether it is right or left sided hemiplegia with or without facial nerve involvement. In the neurological, we will write whether it is right or left sided hemiplegia with or without facial nerve involvement. Okay. Next, in the anatomical, we will write the site of the lesion. Okay, we will write the site of the lesion and what is the artery involved or in the anatomical. Okay, what is the site of the lesion? And so it may be in the cortex, it may be in the internal capsule, it may be in the corona radiata, it may be in the brainstem. So this is included in the anatomical. Next is the pathophysiology. What is the type of the stroke? It may be a thrombotic stroke. It may be an embolic stroke. It may be hemorrhagic stroke. So we have to write what is the type of the stroke. So in the last section I have taught how to differentiate what is embolic, what is thrombotic, and what is hemorrhagic. Okay. Next we have to write the etiology. In the etiology we will write its causes, maybe due to hypertension, maybe due to any dyslipidemia, maybe due to atrial fibrillation, maybe to any valvular heart diseases, maybe due to trauma or rupture of the berry aneurysm all. So we have to include these all. And we have to write if there is any comorbidities. If there are other any comorbidities, that also we have to be included in the diagnosis. So once again we have to include a neurological diagnosis, anatomical, pathophysiological, and etiology. And we have to look whether there is any comorbidities or not. First of all, we have to start with it's a cerebrovascular accident. So now I will say an example how to write a diagnosis. So first of all, it's a cerebrovascular accident, that is CVA. Then it's a case of right-sided hemiplegia. So this is a case of right-sided hemiplegia with right-sided facial nerve involvement. It's a right-sided facial nerve involvement. So it is an ipsilateral hemiplegia. So here the lesion will be above the pons. Facial nerve involvement is there, but the facial nerve involvement and the hemiplegia is in the same side. So this is a ipsilateral hemiplegia. Where we will get ipsilateral hemiplegia? Ipsilateral hemiplegia is present when the lesion is above the pons. Okay. Now next, this is the neurologically classification, that is it's a right sided hemiplegia with right sided facial nerve involvement. Next is the anatomical. So where will be the pathology, where will be the site? So since the most probably the site is in the most probably the lesion is in the left internal capsule. So the lesion will be in the opposite side. Here the lesion will be in the opposite side. So left internal capsule. So it may be a dense hemiplegia will be there. So in an internal capsule, the symptoms is a dense hemiplegia. So it may be a dense hemiplegia. So it is a case of it's a lesion in the left internal capsule. So due to any, and then next classification is the pathophysiological. So that will write as due to any thrombus in the left middle cerebral artery territory. Due to any thrombus in the left middle cerebral artery territory. Okay. So we know that in a thrombotic lesion, the symptoms will be present at the night, in the late night or in the early morning. Patient will wake up with the lesion, and it is a gradually progressive type of lesion. Okay. A gradually progressive type of hemiplegia. Okay, so we have included three things. And this one is the neurological, second is the anatomical, and third is the pathophysiology. Next we have to include what is the what is the etiology. So here the most probable etiology may be dyslipidemia. All due to dyslipidemia, atherosclerosis may occur and thrombus may be formed. Okay, so then we have to include there is any comorbidities or not. So we have to include whether there is any comorbidities or not. So in this diagnosis all four components are included. That is neurological component, that is the neurological component, then the anatomical component is included, and the pathophysiology is included, and the fourth thing, the etiology is also included. So this is the complete diagnosis. This is how we will write a complete diagnosis. Okay, so this is regarding how to write. So this is very simple. If we are knowing it, it's a very simple thing how to write a diagnosis. So thank you.